I thought that support was absolutely fantastic. It's just what I needed. I was so ill. I was almost catatonic, and it was almost as if I was, told to do something, I would go and do something. Yes, so I couldn't have asked for more. I'd been diagnosed with depression 11 years before by my GP, but I didn't need any secondary services up until probably a couple of years before I first accessed them. But at the time, I didn't know what was out there, so I hadn't really gone looking. Difference is that they care. They care about the human being. And their approach, I've only had the one CPN, so I can't compare her to anyone else, but she is fantastic. Is almost holistic. It's not the brain only, it's your whole body, and it's the way that I've always practiced staying well. So to have support in that way from professionals who see the illness in the same way that I do is absolutely fantastic. One thing I'm very passionate about is that they have, every GP surgery have a doctor who was specialised in mental health back in university. I think they should have one doctor in every surgery just for the mental health, because GPs, they have to know so much, and my experiences with GPs haven't been the best. There's psychiatrists being, well, I suppose you could say this about all doctors, but psychiatrists being trained in people skills, learning a lot more about the illness, realising that it's not just an illness that you throw medication at. A lot of factors affect my health. Diet, exercise or lack of. There are many, many things I have to control in order to stay well, not just medication. Actually, I would say self-management is probably about 80% of my well-being, and 20% medication. I think it's fantastic. Vast majority of the time, it's always been there when I'm ill, when I've needed it. There were some, I've had my bad experiences, but I think most of those are down to people skills, not listening. I really would love for mental illness to be on a par with physical illness. Definitely have as much funding, because we need it, we really need it.